I can't say that out of all of these arenas, all of these areas where people work and give their time, that everyone is perfect. There's some great doulas. There's some terrible doulas. There's some great doctors. There's some terrible doctors. There are great midwives. There are terrible doctors, terrible midwives. And
See,
lots,
that was a Freudian
lots in
slip
between.
there. You said, yeah, there's some great and some, and now terrible doctors again. Midwifery has been around for a long time, but in today's world, midwives can be an empowering solution when it comes to childbirth. We're discussing the delivery options for our obstetric patients here in the United States. I am delighted to have our guest, Kimberly Durdin, whose work is centered around childbirth for almost 30 years. We've been doing this probably for about the same amount of time. You're also a lactation consultant. You're the mother of 6 and also a grandmother. You look far too young to be a grandmother.
Well, I like you even more now.
Well, see, there you go. See, that's how we get started on the right foot. Look, I am old enough to be a grandmother. I'm just not. So, there's that.
Sorry about that.
It's okay. I'm just barely getting over my children leaving the house now. It's like, let me have a minute before we bring in the next generation.
I understand.
But I want you to tell me a little bit about your journey and how you ended up, how did you make it from midwife to actually opening the center in LA? So can you tell me a little bit about that?
Well, sure. So yes, thank you. What a nice introduction. I am Kimberly Durdin. I'm more of a recent midwife. I've been licensed now for 5 years, but my journey began almost 34 years ago when I was birthing my first child. I was living in Brooklyn, New York. There were still the yellow pages. I went to the yellow pages and I looked up midwife and I found, I believe there were 2 folks listed there. And I just signed up and started going to see these certified nurse midwives. And we thought I had a couple more weeks before labor was going to ensue, but I was in labor and I went in, they had me come in, they checked me out and they said, oh, her name was Nurse Pink. She said, honey, you're going to have a C-section today. And I literally didn't know what a C-section was. It just wasn't on my radar screen. I did ask my physicians, why can't we just deliver her vaginally, And they were kind of like, well, if her head gets stuck, that's it. First baby, you hear something like that, my next reply was like, cut me open then, because you, as a mother to be, you're really concerned about your child. You don't have time. I wasn't in the space to advocate more. But at the end of the day, I now understand that they may not have had the skill to deliver the baby vaginally. And that maybe if I had found someone that had that skill, could potentially have been a possibility for me, or at least the opportunity to try. So with the next pregnancy, which happened about 2.5 years later, I was more invested in the motherhood community. So I actually found at the time there was one birth center in New York City. I called them up, ready to sign up, but I couldn't birth there. So I was back to square one. Eventually, another good friend of mine talked to me about a home birth. And I had never heard of a home birth. I didn't know that it was even possible. And I actually couldn't understand, how can I have a home birth if I can't go to a birthing center?
Yeah, well, that seems a little bit of a oxymoron here. It's like, wait a minute, it's too dangerous to do it at a birth center, but do it at home.
Right. So I didn't really know how I felt about that, but she gave me 2 midwives to interview. And so it was two midwives. And the first one I called, and her name is Tyoma Allison. She still practices today. When I met her, I knew she was my midwife. I knew it. I chose her because I asked her about her birth experiences. And she said, well, my first child was born in the hospital and it was this and it was that. And my second child, I delivered myself. And when she told me that, I said, oh, if you can deliver your own baby, then I know you can help me have a baby. So we hired her and I ended up having a home birth with my second. And after that,
a piece of cake.
I was just like, I want to do this one day. I want to do this one day.
So Granny Midwives, which is like the history of who these Black women were who delivered babies, certainly in the rural South, They delivered everybody, black, white,
Mhm.
because that's all everybody had was the midwife. And so my mother had delivered her first 4 children at home, delivered by midwives before she moved to Mobile. But the maternal mortality in Mobile at that time was atrocious. And it was through the auspices of the Catholic Church that they started a segregated hospital for Black women to give birth, 9 beds total. She had my sister there, and needless to say, the next child that she had, she delivered at home with a nurse midwife. So this is sort of why I think I was drawn to the field.
Thank you for sharing
Kimberly,
that. I love this
yeah,
history. It means so much to me.
yeah. I mean, I really believe in the fact that every woman deserves to be in a place where she feels seen and heard and respected.
Mhm.
So, can you just explain for about
Sure.
what is the difference
Mhm.
between a doula and a midwife?
Sure. Absolutely. Midwives are specialized maternity care clinicians who support birthing people's reproductive health through pregnancy, childbirth, and postpartum. Along with OBGYNs, midwives are the only providers trained to deliver babies. An element of successful midwifery care is appropriate consultation with OBGYNs and transfer to physician care if the need arises. I just really love that explanation of midwives. Doulas are awesome. They are the helpers, supporters of the birth process, also the prenatal process, the education piece, and the postpartum as well, whether it's a doula that's helping a birthing family in the postpartum or just visiting them a couple of times because they supported them in their birth. They are there for emotional support, for the physical support, like I said, the education piece, but they're completely non medical. That's the hallmark of doulas. And I would say that these days, people are hearing a lot about doulas in the birth ecosystem, but they still often aren't hearing about midwives. But people often get doulas and midwives
Mhm,
confused.
mhm.
So, or they'll use them interchangeably. And they're actually two different distinct different things.
It's funny because I have worked with doulas, and and we're going to have a perfectly honest conversation
Mhm.
here, all right? And I will tell you from the doctor's perspective, like what we feel about doulas, okay? And and invariably what happens is, someone will come in and they'll have a pages long birth plan, and you're like, oh my God,
We
here
were
we
just
go.
talking
We
about
know this is we know what that means. All that birth planning stuff is like, okay, go ahead, let me hear it. But doulas, I think, are helpful because they fulfill a role that
Mhm.
really doctors and nurses can't do. Because
Correct.
honestly, they just don't have the time.
Mhm.
I'm going to come and check on you. I'm going to make sure that you're taken care of, but I'm not going to walk with you down the hall for
That's right.
3 hours.
That's right.
That's not my role.
Mhm.
And so I get that, but I also, where the friction and I think and the headbutting comes in, and just as you said, a midwife is a trained professional. You are there. You can do what I do.
Except
For
surgery. I don't do surgery.
except surgery, but you can deliver a baby. And the tension and the rub comes in when they would tap you on the shoulder and say, "Well, I think." And you can imagine how that goes over. Now, that when somebody's
I
saying, I'm
do.
like, well, thank you for that. Thanks for sharing. But I don't need a doula. Okay. You're there for the patient. You're not there for me.
Right.
And that's where I think that when people really think about, like there's some great, sort of, uh, tension in the community, it's really not that. As long as everybody sort of understands what their roles are
Mhm.
and what you're there to do, then we can all work well together. Because let me tell you, I
Mhm.
understand that people might want to have a different experience, but I also want you to talk about a little bit the fact that there are midwives and midwifery practices that are associated with doctors,
Mhm.
and that they work, and the doctors are there just sort of for backup,
Mhm.
and they deliver in hospital or
Mhm.
hospital affiliated birthing centers
Oh,
as
well,
well.
absolutely. That was a lot of what you just said, there's so many different points that I would love to respond to. Well, one, I guess I'll start with the doula. Doulas, there is in any profession, there are best practices, let's say. And one of the things that's interesting about Black doulas and people of color doulas is that we have allowed ourselves to claim that we can advocate for our clients. To your point about the idea that just listen to your doctor, just trust your doctor, it is very much ingrained in us. And therefore, many people are intimidated to talk to their physicians about things that they really have on their mind. They leave a lot of things unsaid. Often because if they're making lists of questions, they come into their physician, they want to talk about all these things, and their physician's like, I don't have time to answer your questions. And people feel that. And so they have to go other places to get, they're either will stay silent, not have those questions answered, or they're going to continue to seek out where they can get answers to those questions. Doulas can fill a big role. And I think that we have to find a way where it's not a battle between physicians and doulas, where physicians and doulas can collaborate and work together, just like we want physicians and midwives to work together. I can't say that out of all of these arenas, all of these areas where people work and give their time, that everyone is perfect. There's some great doulas. There's some terrible doulas. There's some great doctors. There's some terrible doctors. There are great midwives. There are terrible doctors, terrible midwives. And
see, that was a Freudian slip there. You said, yeah, there's some great and some, terrible doctors again.
But, and a lot of, and everything in between, right? You know what I'm saying?
Right.
And so we owe it to the folks that we are serving to continue to build bridges amongst our professions, so that we can keep the birthing person, woman, family in the center, and the baby, right? In the center. And that we're coming up with ideas of how to collaborate, and how to join forces, and also to learn from each other. Because one of the things that can enhance care overall that doesn't happen a lot in mainstream medicine is continuity of care. And that is very important to people who are giving birth. Like, I hear it over and over and over again. And that is one of the main reasons people come to us for care or come to midwifery care. They want continuity of care. Back to doulas, they can be one of the only folks involved with the birthing family that is giving them that continuity. Because one thing is for sure, that if you hired a doula, that's going to be your doula. You're going to be able to lean into them, and in a way that you can't with a nurse that you come in contact with once, or a physician, and then the next time you go in, you have another physician and things of that nature.
Right. Because that's what we would ask you to do. We say, please rotate and see the doctors, because you never know who's going to be on call
and that's
the night
all
that
well
you come
and
in.
good, because in our practice at Kindred Space LA is 4 midwives. And that's all well and good. We're all about the rotation and all of that. However, the problem is that if you're rotating through your physicians and they're already seeing you for 5 minutes, it's just not enough time for the physician to get to know that individual person, and for that person to get to know that individual physician. And it is a point of stress and distress for many birthing families. I hear it all the time. And so not only is it a quality of life, literally life issue for our clients' patients, but our physicians are struggling under the weight of having to care for 17 patients in 1 hour for all the hours of the day that they're working. 40 and 60 patients a day, for instance.
That's outrageous.
This is outrageous.
That's outrageous.
Thank you. And it's based on finances. It's based on reimbursement rates and things of that nature. And they're suffering too.
Every year, as New Year's approaches, my family and I have a little ritual. We pick a place where we can step into the new year with intention, somewhere peaceful, somewhere that lets us close the chapter on the past 12 months and welcome the next with open arms. This year, we chose a quiet lakeside town. We wanted space to gather, cook, laugh, and stay up far too late, talking about the year behind us and the one we hope to build. As we settled into the home we booked on Airbnb, lighting candles, chopping vegetables, and putting on the playlist my kids tease me for, I looked around at the people I love most. There's something grounding about being together in a place that feels warm and lived in, especially as the calendar turns. And I found myself thinking, while we're here making our own New Year's memories, someone else could be enjoying our home and starting their year with a fresh sense of possibility too. Your home doesn't have to sit empty while you're away. It can become a gathering place for another family, a place to cook their first meal of the new year, to share their resolutions, to rest, reset, and step into the next chapter with hope. And the extra income you earn from hosting, it can help support the things you want to bring into your own life in the new year. Another trip, a long-awaited project, or simply a little more breathing room in your budget. Your home can help someone else start their year on a beautiful note and help you reach your own goals too. Your home might be worth more than you think. Find out how much at airbnb.com/host. There has to be some collaboration between doctors and midwives because they're just not enough. They're not enough of us, and we don't have enough time to do the job that we want to do. And I want to talk about your birthing center, and I want you to tell me, okay, so what is available at your birthing center? I mean, if someone decides, okay, I've got it, I'm here, I want you to tell me who's a candidate,
Right.
one, because not everybody can deliver at a birthing center.
Mm-hmm. I wouldn't advise certain people to do.
So tell us who can and who probably should not be delivering at a birthing center or at home for that matter.
Well, I do want to qualify and say that midwives work everywhere,
right?
Depending on what state you're in. But in California, we are legal out of the hospital, legal to work out of the hospital, either in homes or birthing centers. And also we have certified nurse midwives who primarily work in hospitals. CNMs are legal in every state in this country. And people who have risk factors that wouldn't make them eligible to birth outside of the hospital, and I can get into that, can still have magnificent births in hospital with midwives or physicians. So we only can take care of low-risk people. So what is low risk? So basically, it's someone that's not coming in with a pre-existing condition that would make them high risk. So that could be they already have diabetes. They already have high blood pressure. Maybe they've had a numerous amount of, let's say, preterm deliveries. So that's going to be a risk factor, right? There are things like that. One of the things that we don't consider high risk is age.
You don't? I was going to ask you that.
That means nothing to us.
Okay.
That means nothing, because I've had very unhealthy 18-year-olds want to come in and birth at our birth center. And unfortunately, they're not healthy enough to do that. They need physician care. But I've had extremely healthy 40-something-year-olds that come and birth with us. I myself had my last child at 46 years old at my home. Kind of sound like your mama.
Sound like my mom, yes.
And, but I was healthy and I'm still healthy.
A woman who is 45 years old, who is pregnant for the first time, could deliver in your birthing center.
Sure, because remember that we're going to do all the assessments with them that we would do with anybody else. And as long as they're tracking healthy, their blood pressure is great, they don't have gestational diabetes, their the fetus is growing normally, then we don't automatically say because of age, you can't deliver with us. If they're, hitting all the bells and whistles in their pregnancy, we might employ some extra monitoring a little early on at the end of their pregnancy, maybe some earlier NSTs. We'll send them in to our favorite hospital in LA.
And for those who don't know, that's a non-stress test. That's just where you just monitor the baby's heart for, to make sure it all looks going
good.
well. Yes.
Fluid is great. Placenta's doing good stuff. And if not with anybody else, if things are off, we would recommend that they birth in hospital.
Right. And I think that that's an important point for our listeners to understand is that, not everyone is a candidate for delivering in a birthing center. And certainly, as I say, don't try this at home unless you make sure that you have been cleared and medically medically cleared to do this. The one thing that, and the difference, here's the difference in perspective, at birthing centers, you're delivering low risk patients. And when you're in the hospital,
it could be
all
anybody.
comers.
That's
it's
right.
like you got to take everybody,
That's
no
right.
matter what your health history or circumstances may be.
Correct.
And I think that sometimes that's where I think that a little bit of the confusion comes in, because when people say, well, birthing centers, we have, our rates are so much better. And it's like, well, yeah, ours would be better too if we just took the people who didn't have any risk factors.
Exactly.
So that you have to take into account.
Right.
And I also want to ask, do you have the ability to, if someone decides they want to have an epidural?
Well, they probably wouldn't want to come to our birth center because we don't give epidurals.
That's a good thing to know.
Epidural is when an epidural is given, and I think, by the way, that it's an amazing tool.
I love an epidural. Yes, okay.
It's an
I'm
amazing.
talking for me personally.
It's an amazing tool when needed, if needed.
Right.
However, you need more monitoring for that, and so that alone is a reason to be in the hospital, because you're going to need more monitoring than we would do out of hospital.
Right.
And as a matter of fact, I am more than happy to help a person in that situation get to safe hospital care and I'm like, hey, an epidural is going to help you right now because you're going to be able to sleep. You're still early on. And this is going to allow you to regain and retain your energy so that you can still have the birth that you're hoping for.
And you have an ongoing relationship with a hospital that will just go ahead and they take your patient's transfer and you can go right from that.
We love our transfer hospital. It's MLK, Martin Luther King Community Hospital. It's based in Willowbrook, South LA area. It's a hospital that serves a primarily Medi-Cal population. And Angela Sojobi at MLK Hospital was one of the first providers that actually came to the folks, the community midwives, and said, please transfer your patients here. We would love to take care of them. And that just changes the trajectory. What happens is that many people who are birthing outside of the hospital, the last thing they want to do is go to the hospital to have their baby. But at the end of the day, I'm a poor provider if I'm not preparing you for that possibility. Right. And so my job is to prepare folks along the way for the fact that transfer is possible. And here is a place that we have already vetted. We have already built relationship with these folks. And we actually would love for you to go on a tour there. We want you to get to know those folks. Because if you end up in the hospital, you go there, you're going to have a much smoother transfer on for you. And that's what you want.
Well, I think that, it is impossible to believe that there is going to be a future in obstetrics that does not involve midwives, because we still have to deal with the fact that, for here, in LA, to go to a birthing center or go to the hospital is a choice. But there are so many women out there that, 50% of the counties in the United States don't even have a practicing OBGYN. And as they're closing rural hospitals, we have to come up with some way to not, again, as a byproduct, increase the maternal mortality because women are getting no care.
Exactly.
And that's the message that I really want to leave. The reality is that more women get into trouble and die from no care than bad care.
In the postpartum, I've heard some statistics that 50% of postpartum deaths, 50% of deaths are happening in the postpartum.
Exactly.
So we absolutely cannot sweep that under the rug as an afterthought. I will say that mainstream medicine does not do a good job of checking up on our clients and on our patients' clients in the postpartum. There's usually one visit. You see your providers in the hospital, and then you have your next visit at 6 weeks. And that is just not adequate enough. What happens when that mom gets high blood pressure? No one knows because no one's checking. What happens, if she's bleeding out and we can't help her because she's already gone? I think that people have to know that postpartum, it doesn't end at 6 weeks.
Exactly.
It just, honestly, it's the rest of your life.
One of the things that I want to leave, our listeners with is that when you are making these decisions, understand that it is a choice. And we want women to have as many choices because only you know the type of birth experience you want to have. And so I think that, at the end of this, we're pretty much in agreement, know what your choices are, know what center, know who's a candidate for a birthing center and who is not. And I think the most important message that I would give to my patients is that whether you're dealing with a birthing center or you're in a hospital or you're in postpartum, the message always is don't ever let anyone tell you how you feel. And I think that we all, as women and as sentient beings, when something is not right.
Absolutely.
And if you feel that and you feel that in your heart of hearts, and then someone tells you, oh no, it's fine, it's good, you're good. Because a lot of these the birth horror stories that we hear are always sort of comes around to, I said this,
right.
I complained,
wasn't being listened to.
I did this, and no one paid attention to me, or I was put off by that. So that's a really important message, is that if you feel something is off, please don't be put off because someone else told you that you're okay.
Agree.
You know better than that.
I think that is such a strong point to hit home for women, because I find that as women, we tend to internalize a lot of things. We're like wired to internalize. Oh, well, they said I was fine, so I guess I'm fine. Well, what are you really feeling?
What I really want to ask you now, as we're sort of winding down, is that you have, doing what you've been doing for the past 5 years, and you've been, sort of in the birthing space for much longer,
for 30 years, yes, absolutely.
For longer than that. If you had to give our audience 3 main points about, what do you think, about midwifery? What do you want them to go home with?
My first point is for everyone, but particularly folks seeking like this specialized out-of-hospital midwifery care. You cannot buy your birth experience. Do you know what I mean by that?
No, explain to me, what do you mean by that?
Okay. So there are occasions where people have enough money to, let's say, buy the most expensive, wonderful care package that we offer. Our care is out of pocket, okay? And we can talk about that too, but we have different levels where people can receive excellent care, but also can fit their budget. And also, we work with a lot of wonderful organizations that provide grants to supplement the cost. Sometimes our folks don't even pay for their care at all, even though it's all out of pocket. And so if you have a person who doesn't or isn't willing, they've bought their package, their midwifery package, but they're not willing to do the work of what it takes to be a healthy pregnant person and maintain that health throughout the pregnancy. Whatever things that they need to work on to get there, they have to do it. I can't do it. It is the part of pregnancy that sometimes it's very provider focused. If I get the right provider, I'm going to have a safe and healthy birth. But we often need, I think it's really important for people to remember that they have to do work too. It's not just about purchasing a birth experience and then your baby's going to fall out of your vagina and everything's going to be fine. It doesn't always work like that.
If only.
The second thing I would like people to know, in this climate of this, we're bombarded with, it's Black Maternal Health Week right now, which is wonderful. We get to talk about these issues and these challenges, but the focus is now turning towards, can we talk about joy? Can we talk about how does joy play a part? We have been bombarded with death, dying, and illness and sickness in pregnancy as Black people and people of color. And that saddens me.
Right.
And I think that I want Black women and people of color, birthing people, to know that they are not a walking risk factor. Like, the color of their skin does not automatically make them a risk factor. I want them to know that. I want the medical community to know that. Because often folks in the mainstream medicine, because they're learning so many things and they're trying to understand these patterns, if the wording isn't right, they can say things that make it sound like that you are a risk factor because you are Black.
Right. You are the problem.
You are the problem.
You are the problem.
Right.
I agree. That is not the language that we really want to lead with. And I think that, again, when But when we allow the medical profession, and this extends far beyond obstetrics, this is all around, is that's the easy route because it allows you
That
to
part.
not address the things systemically that are problematic that you can address.
100%. And then last but not least, I would say that it really, if you are planning to have a family, take care of your health and think about preconception health. Think about, okay, me and my partner, or me, myself, and I want to have a kid. I want to bring a child into the world. Well, go get yourself checked out. Take the steps that you can to be as healthy as you possibly can be before conception.
Exactly. Kimberly, I cannot thank you enough for this conversation. This has been fun. And I hope that everybody learned something. That no, doctors and midwives are not at each other's throats about this.
We need
work
each other.
together. We need each other. And we have a similar goal, and that is to make sure that every mother and every baby gets here healthy and happy. And to our audience, I want to thank you for listening and tuning in and for joining us. I'm going to take some issue, a medical issue that is maybe complicated that you may not understand, and really break it down and speak to people who have, and I need sometimes, a second opinion.
I love it. Thank you for having me.